Hey YouTube, Chantel again. So today I'm doing a video. I am and have been sort of feeling bad these past weeks. And if anybody has been following me, they know that, or maybe I didn't disclose that. I know I said one time. I've been having a series of abscesses in my surgical wound, my main surgical wound where they had the port out of. So, yesterday I've had so far I've had two, and yesterday I had felt like I had another one in the same spot coming on. So I had hesitated to go back to the doctor because one of the reasons is I had already kind of figured that, kind of thought that this is what this is what it was. And then the other thing was that, if anybody knows, I went to Mexico to get my to have my sleeve done, and I also had my lap band done there. So if anybody that has been to Mexico knows that when you come back into the United States and have to have follow-up care, some of the doctors are not the kindest towards you in regards to you going to Mexico to start with. So they have their own opinions about it, and in my opinion, they need to be professional and either work on me or don't work on me. Don't give me a lecture. So so basically, that's kind of where I was at. I just didn't I just didn't really want to hear it, and I've been through ERs. I've been through doctor's offices and in these last 9 months regarding this issue, and I've heard just about all of it. So, however, I went to another clinic that I go to it sometimes, and I hadn't been there in this series of episodes that I've had with this, and surprisingly, they were so supportive. And by the time I left there, I was in tears. And just because it was one of the first times that I had been somewhere since I'd been back from Mexico and had been dealing with this, that someone actually brought up to me the fact that this is just can be a complication of this type of surgery. And the complication is, and it's something that has never been brought up to me before, is that I possibly have what's called a fistula. I had no clue, or had I ever heard of anything like this before in terms of this recurring abscess that I'm having. And basically what he told me was that I needed to go back to my surgeon who I worked with originally, not in Mexico, but which if I wanted to go back there, they would happily accommodate me, by the way, for any of you Mexico critics. But the one that originally handled my first abscess. And so I'm waiting to hear back from him, and I'm going to try to go back to him. He was one of the least critical and did help me the first time. So basically what they're saying, from what I understand and what I've looked up, is a fistula is a type of passageway / hole opening from one place, an abnormal opening from one place to another that allows fluid or to seep in. And there's several different types: blind, closed on one end, opened on both. And so I'm not exactly sure. And I've had 2 CAT scans done that's never seen or caught this problem. But from what the doctor told me, and he was an emergency medicine doctor for, I think he said 30 years, that sometimes they collapse, and unless there's pressure on them, you actually can't see them. So at this point, I was very relieved to hear that maybe that this is what it is, because this is just continuing to be a problem for me. And but in another way, I'm very I'm apprehensive about it. And from what I've read, it's not a really common occurrence with this type of surgery. Lucky me. From what I've read so far, maybe like 0.5 to 1-2% people does this happen to. So I am in the process of trying to see about it. I don't have health insurance at this time, nor did I when I had the surgery. So, that's an issue as well. But, I'm going to deal with whatever I need to deal with to get myself better and to make sure that, that I'm able to have a normal functioning life. I mean, I can't really do anything, whenever you're in pain. Whenever you're constantly worrying about exercising or, doing anything. I've had zero food issues and issues with losing my weight. But I've had this particular issue, and this will be the third round with it. And that's the very first time that anyone has told me that. And again, I think that goes back to I haven't had a big continuity of care since I've been back here because I've had to flip-flop from doc to doc in regards to someone trying to help me. And that's a reality of people that do go. One of the things that the doctor brought up to me yesterday was that that's a reality in general. If a surgeon botches you, and I don't want to say that because I don't believe that I'm botched, but if you have complications with any type of surgery, regardless of whether it's just the nature of the surgery that you've had, a lot of other surgeons don't want to touch you with a 10-foot pole because of their liability risk. So that's not just when you go out of country to have something done. It's also whenever you have something done here. So this is just kind of wanted to update. I may or may not post this video. I don't know because I'm feeling really bad right now, and that's not normally how my videos are. But they did give me some medication and some pain patches and that type of thing to manage the pain until I'm able to have it seen about. And I know the process is going to end up, it'll end up rupturing, or they'll have to rupture it, and which I can tell you is not fun. But I'm hanging in there, and still I have no regrets whatsoever. So, but I did kind of want to bring it up, as just a side note of people that have had problems and that, or people that go to surgeons or to other countries and have procedures done. That this is a reality that you have to deal with, and people are very critical, especially surgeons. I mean, I had one surgeon, just get in my face and just totally ask me, why did you do this to yourself? And why did you put this on yourself? And my feelings were really hurt when he told me that, And, you get really defensive. You get really defensive because these are the same people that, that charge exuberant amounts for and don't give cash discounts. Because I ask for a cash discount every time. How much would you, if I paid cash or if I, and they charge these amounts a lot of times because they know the insurance companies set the rates and they're going to pay them. And for those of us that don't have insurance or that have to save every penny to,